and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. This month, we will discuss 2 articles over 2 short episodes from the upcoming issue of the Journal of Athletic Training. In the first episode, I will talk about a systematic review with meta-analysis about eccentric training and biceps femoris architecture, while the second episode discusses the development of pace-based definition for hitting the wall during running a marathon. As a reminder, the article discussed today can be found on the JAT website, natajournals.org. And please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. The title of the first article is Eccentric Training in Biceps Femoris Architecture and Strength, a Systematic Review with Meta-Analysis, authored by physical therapist Rémy Gérard and colleagues from the Institut Parnasse ISEI in Brussels, Belgium, and the University Hospital Ghent, also in Belgium. Let's survey the scene. Hamstring strains are one of the most common injuries to occur in sports characterized by repetitive states of sprinting to jogging, such as soccer, Australian football, rugby, and track and field. Over 80% of hamstring strains involve the long head of the biceps femoris. These injuries typically occur from either extreme joint positions of hip flexion and knee extension, or during the terminal swing phase of sprinting when the muscle is eccentrically overstretched. Unfortunately, not only are these injuries common, but are also associated with time lost from sport and a high risk of reoccurrence. Presently, evidence is inconclusive as to whether common interventions such as flexibility and core stability training reduce hamstring strains. However, multiple trials have found eccentric strength training to be an effective strategy to decrease rates of hamstring injuries across several field sports. In addition, studies have found muscle architecture, such as shorter fascicle length and increased pronation angle, to be either a risk factor or consequence of hamstring strains. Considering that eccentric strength training can alter muscle morphology may explain the mechanism of its effectiveness. However, the relationship is not fully understood. Further understanding the mechanism in which eccentric training reduces strain rates could be beneficial for further enhancing risk factor screening procedures and prevention programs. Therefore, the purpose of this systematic review with meta-analysis was to provide an evidence-based framework for eccentric hamstring training to reduce hamstring strains and to synthesize the effects of eccentric hamstring strength training on biceps femoris architecture and strength in healthy adults. PubMed, Pedro, CNOL, and Sport Discus, in various combination of key terms, eccentric strength training, eccentric loading, Nordic hamstring, hamstring strength, fascicle length, pronation angle, muscle thickness, muscle architecture, bicep femoris long head, biceps femoris, and hamstring muscles were used. Articles were screened separately by 2 of the authors. Inclusion criteria is as follows. First, the participants of the studies had to be healthy. Second, the participants were adults between 18 and 50 years of age. Third, the study design was a randomized controlled trial and allowed comparisons between only eccentric strength training for the biceps femoris muscle and other programs. Fourth, the program intervention in both comparison groups lasted at least 4 weeks. And finally, pre-evaluations and post-evaluations included hamstring eccentric strength and biceps femoral architectural assessments. Methodological quality was evaluated for each individual article, and an overall level of evidence was established based on standardized criteria. Following the search procedures, the authors identified 251 studies. Authors reviewed titles, abstracts, and methods. 10 studies met the criteria and were included in the review. Across the 10 studies, there were 346 participants, with the average participant age for each study ranging from 18 to close to 30 years of age. Participant populations included professional, semi-professional, and amateur soccer players, as well as recreationally active participants. For the eccentric strength training intervention, most studies elected to use the Nordic hamstring exercise. While 2 studies used eccentric hamstring curls, 1 study used hip extension exercises, and the 10th study used an eccentric knee flexion exercise. The duration of training ranged from 4 weeks to 10 months, with an average of 1 to 3 training sessions per week. All studies assessed eccentric hamstring strength and bicep femoris architecture at baseline and within 7 days of the final training session. Muscle architecture, specifically fascicle length, muscle thickness, and pennation angle, was assessed using ultrasound. Here are the primary results when synthesizing the findings of each study. Moderate evidence indicated that eccentric strength training more effectively increased fascicle length. There was limited evidence to suggest that eccentric strength training was more effective at increasing muscle thickness and reducing pennation angle when compared to other interventions. And finally, there was moderate evidence showing that eccentric strength training was more effective at improving eccentric hamstring strength than the comparison interventions. Overall, the systematic review with meta-analysis found that hamstring eccentric strength training positively affects modifiable risk factors associated with hamstring strains. The observed increases in fascicle length following eccentric training are thought to make the muscle less prone to injury by increasing the number of in-series sarcomeres, which in turn increases the capacity to support stretch and reduce strain when the hamstrings are actively lengthened during intermediate high-intensity exercises common to field sports like soccer or rugby. Although muscle thickness is not considered a risk factor of hamstring strains, both increases in muscle thickness and pennation angle are linked to increasing the number of in-parallel sarcomeres, which is one well-established mechanism in which a muscle is able to improve strength. However, specific to hamstring strains, this mechanism to improve strength may not be ideal, as there is a potential negative trade-off of gaining strength through these architectural changes, which is that these changes may impede fascicles from lengthening in response to training and therefore decreases the muscle's capacity to support stretch and reduce strain during activity. This review shows that the mechanism in which eccentric strength is improved is perhaps more neurally induced rather than architectural. Overall, this systematic review with meta-analysis supports the use of eccentric strength training for the prevention of hamstring injuries, as this type of training positively modifies risk factors associated with hamstring strains. Some recommendations the authors provided is the use of the Nordic hamstring exercise, as this exercise has shown to be effective, easy to perform, and requires no equipment. Also, after reviewing the 10 studies, the authors recommend training to occur 2 to 3 times per week over a minimum of 4 to 6 weeks. After warm-up, athletes should perform 2 to 6 sets of 5 to 12 repetitions with 30 to 180 seconds of rest between sets. More research is needed to determine the best parameters, such as amount of knee flexion needed during the exercise and the velocity while doing the exercise. But the current evidence does support the use of hamstring prevention in healthy individuals. Well, that is it for today's JATCast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about the upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening and keep a lookout for next JATcast episode.